Okay, it's recording now. So this is an overview of what we'll be covering today. We'll start with the different types of psychological disorders, then we'll talk about neurocognitive disorders, specifically Alzheimer's disease and Parkinson's disease, then stress and the different types of stressors, and finally we'll go over sleep and all of its stages. All right, we'll start off with anxiety disorder. Panic disorder falls under a type of anxiety disorder and describes the fear of panic attacks. To be diagnosed with panic disorder, you have to have experienced at least one panic attack. Is everyone able to hear me? Okay. Okay, Miriam, maybe try connecting and disconnecting the audio. Yeah, okay. So, like I was saying, to be diagnosed with panic disorder, you have to have experienced at least one panic attack. Panic attacks can be triggered by specific things or reminders, but can also be spontaneous. Finally, panic attacks are described as having shortness of breath, chest pain, sweating, rapid heartbeat, and it usually lasts for less than 30 minutes. Some people describe it as having a heart attack. Individuals with a generalized anxiety disorder are usually anxious most of the time, but don't experience panic attacks. So that's the difference between GAD and panic disorder. So their source of anxiety can be from various things, or they may not have a specific source. So these individuals will typically experience insomnia, irritability, and an inability to concentrate due to their constant anxious state. Phobias you're probably familiar with. They're described as a strong, consistent, unreasonable fear of a thing or situation. People with phobias know that their fear is unreasonable, but they'll experience anxiety or panic attacks when exposed to their fears. So this disorder gets debilitating because people will go to great lengths to avoid their fears. And specific phobias can fit into four distinct categories. The first being situational, such as airplanes, elevators, crowds. The second being related to blood, injections, or injury. In other words, having a phobia to needles or surgery or blood. The third is natural environment. So some are afraid of lightning or thunderstorms. And finally, animals. So lots of people may have phobias to spiders or snakes or dogs. The last type of anxiety disorder is social anxiety, which describes an unreasonable fear of feeling embarrassed or watched by others when doing simple things, such as eating in public. Again, this can be debilitating as people may feel the need to avoid public spaces. Right, let's talk about obsessive compulsive disorder, also known as OCD. Obsessions are defined as intrusive thoughts that cause stress, such as a fear of being contaminated by germs or a fear of harming someone unintentionally. Compulsions are repeated behaviors that are performed in response to an obsession or in order to follow a specific set of rules that one creates for themselves in order to reduce stress or prevent something bad from occurring. I highlighted the words in response because it's important to know that these actions are performed in order to ease their anxiety. And an example of a compulsion would be washing your hands for a long period of time because you're afraid of this contamination, or performing a task for a specific number of times because you're afraid something bad will happen, or arranging things in a specific way. So before we move on to trauma disorders, does anyone have any questions so far? Okay. So post-traumatic stress disorder, also known as PTSD, is defined as an intense feeling of helplessness and fear after experiencing a traumatic event. For example, death, serious injury, or sexual violence to either themselves or others. So they can either have experienced it or witnessed it. Individuals with PTSD relive this traumatic event through flashbacks and nightmares, which can be spontaneous or triggered by familiar reminders like smells or sounds. So these individuals will often avoid reminders of the event. So they'll avoid people, places, or feelings associated with the traumatic event. And an individual can also experience hyperarousal, so increased heart rate, anger outbursts, or hypervigilance. And to be diagnosed with PTSD, these symptoms must have been occurring for over a month. Acute stress disorder is similar to PTSD, except that the symptoms will have last for 3 days to 1 month. So people usually start off with being diagnosed with acute stress disorder. And if their symptoms persist for more than 1 month, they'll be diagnosed with PTSD. Moving on to somatic symptom disorder. It's defined as experiencing and complaining of somatic symptoms, such as chronic pain and headaches, which caused decreased functioning due to extreme anxiety about these symptoms. In other words, it's caused by extreme stress due to persistent physical symptoms and concerns about these symptoms. Another disorder that is low yield, which is why I didn't include it on the slides, is illness anxiety disorder, which is also referred to as hypochondriasis. I'll type it on the chat. And this is basically the fear of being ill despite not feeling ill. So, conversion disorder, on the other hand, is a change in sensory or motor function, such as weakness, tremors, or seizures that have no physiological cause, but they may worsen after an emotional event or a stressor. The name of this disorder comes from an emotion being converted into a physical symptom. And factitious disorder, you may have heard of this one. It's when a person intentionally exaggerates or induces symptoms of an illness on either themselves or another person to attract sympathy and medical attention. Does this make sense so far? Okay. Bipolar disorder is described as cyclic episodes between depression and mania, so two extremes. Mania is a feeling of euphoria, but can also be accompanied by irritability and high energy levels, as well as high productivity. So there are two types of bipolar disorders, bipolar 1 and bipolar 2. Bipolar 1 is defined as spontaneous mania, where a person has to have experienced at least one manic episode. Bipolar 2 disorder is a less extreme form of bipolar 1. Basically, the manic phase is more mild and lasts for more than 4 days, which is referred to as hypomania. So, whenever you see the word hypomania, always think bipolar 2. A person must have experienced at least one hypomanic episode and a major depressive episode, in which the person will experience a depressed mood, no interest in activities, changes in weight and appetite, insomnia, agitation, low energy, and suicidal thoughts or tendencies. Okay, here's a question for you guys, and you can just type your answer in the chat. Yeah, everyone seems to be on the right track so far. So the answer is A. Like I said, bipolar 1 disorder is diagnosed by having experienced at least one manic episode, and it doesn't require a major depressive episode. So, to be diagnosed with bipolar 2 disorder, an individual must have experienced at least one hypomanic episode, which is item number 3, as well as one major depressive episode, which is number 4. Okay, so major depressive disorder is diagnosed by having had at least one depressive episode and can occur with changes in the seasons, also known as seasonal depression. Persistent depressive disorder is a more mild but also more chronic form of depression. Persistent depressive disorder is more mild because there is no actual episode, just symptoms that last for most days of the week for at least 2 years. All right, here's another question. Yeah, so the answer is C because, like we said, conversion disorder is a type of somatic symptom disorder in which an individual has functional impairment of a limb with no apparent physical cause. So A is the definition of anxiety disorder. B is caused by a fictitious disorder in which a person creates an illness. And D is hypochondriasis, which is the fear of having an illness. So you may be familiar with schizophrenia, which is characterized by the presence of positive and negative symptoms. Positive symptoms are the presence of abnormal behavior, such as delusions, hallucinations, and abnormal patterns of movement and speech. Negative symptoms are a lack of normal behavior, such as decreased speech and motivation, as well as a flat affect. To be diagnosed with schizophrenia, an individual must be experiencing positive and negative symptoms for at least 6 months. So moving on to dissociative disorder, which is described as a disconnect between a person's thoughts, feelings, and memories from their conscious awareness. These disorders are usually brought on as a defense mechanism from a trauma. So there are three types of dissociative disorders that you need to know about. The first is uh, dissociative identity disorder, which is defined as having two or more distinct identities. Individuals with dissociative identity disorder will use different identities to interact with specific people. In other words, they alternate their identities depending on who they're talking to. Interestingly, they may be entirely overcome by their identity, such that they have no recollection of their actual or other identities. So their identities can vary drastically in age, gender, and traits as well. The second type of dissociative disorder is dissociative amnesia, which involves having had at least one episode of forgetting important personal information. This disorder is usually related to a traumatic event because people will have wide gaps of memory revolving the trauma. So during the episode, a person may wander around aimlessly, which is called a dissociative fugue. And during the episode, the gap in memory may be centered around the trauma or it can be generalized. So the person's entire life could be forgotten. And it could also be continuous. So everything after the trauma is forgotten. And this disorder can occur suddenly and can disappear suddenly as well. The last type of dissociative disorder we'll talk about is sorry, personalization disorder, in which a person has a recurring feeling of being detached from their body and mental processes. So it's sort of like an out of body experience. The difference between this and the other disorders is that the person is aware that what they're feeling is wrong. Similarly, however, the onset and recovery can also be sudden. All right, here's a question. Okay, so Cynthia is right. The answer is C. Would you want to volunteer and explain or? Yeah, so catatonic means unresponsiveness, a lack of movement. Um, the word catatonia should tell you that the person is most likely experiencing negative symptoms more than positive symptoms. Because, like we said, negative symptoms refer to a lack of normal behavior. So, because the individual is not moving or communicating, we can conclude that the negative symptoms were dominant. So, whenever you see catatonia, you can always connect that to negative symptoms. Mhm. All right, now we'll move on to personality disorders, which is defined as a rigid set of personality traits that differ from cultural norms. This disorder can be debilitating because it impairs normal functioning and can cause depression. Sorry, 1 minute. Okay, there are three categories that you should know about. Sometimes the MCAT will describe an individual's behavior in the passage, and they'll ask you to identify if the person fits in the cluster A, B, or C. So people in cluster A are described as paranoid, schizoid, and schizotypal. All of these terms are different and we'll go into them. The individuals are usually irrational, cold, and suspicious. And people in cluster B can be antisocial, borderline, or histrionic. And their behavior can be categorized as emotional, dramatic, or attention seeking. Finally, people in cluster C can be avoidant and dependent, making them tense and anxious all the time. All right. So, looking into the meanings of the clusters, a person with paranoid personality disorder will usually mistrust other people's actions despite not having any evidence. So, they tend to be suspicious and they'll be guarded and always tense. A person with schizoid personality disorder is a loner. They have little involvement with their friends and family, and they appear unemotional and cold. They're described as schizoid because their behavior resembles the negative symptoms of schizophrenia, such as lack of communication and flat affect. Finally, a person with schizotypal personality disorder will experience delusions. They'll be paranoid and they will have abnormal patterns of speech. So this should remind you of the positive symptoms of schizophrenia, which explains the name schizotypal. The way that I remembered it on the MCAT, this is kind of weird, but schizoid has fewer words than schizotypal, and schizoid refers to the negative symptoms of schizophrenia. So negative meaning like taking away words. I don't know, that's just a weird way to remember it, but if that helps you, go for it. Okay, so moving on to cluster B. A person with antisocial personality disorder will have a history of behavioral problems as an adolescent, such as getting into fights, being aggressive towards people and animals, destroying property, and stealing. These people will also have no remorse for their actions. And this type of personality disorder is also more frequently found in men, specifically incarcerated men. A person with borderline personality disorder is described as being impulsive, experiencing extreme mood swings, and having an unstable sense of self. These individuals will be paranoid of abandonment, and they will usually idealize a person, but will afterwards demonize that person. So, important to note also is that these individuals are very clingy. And a person with histrionic personality disorder will convince themselves that they are the center of attention. They will go to the extremes of attention seeking behavior through means of seduction and their appearance. This disorder usually appears first during childhood. And interestingly, although their emotions may seem very profound and dramatic, but they're actually very shallow in the inside. So, a person who is narcissistic is described as having an incredible feeling of self importance, and they crave admiration and attention. They also have no empathy for others. So that's what makes it easy for them to exploit other people. They're also arrogant and they believe that they are superior and no one else matters. Finally, moving on to cluster C, a person with avoidant personality disorder may feel inadequate or undesirable, and they may be afraid of criticism and conflict. This person may appear to be extremely shy and will avoid relationships and new activities because they're scared that they will be disliked. A person with dependent personality disorder feels the need to be taken care of, and they're convinced that they're unable to do so themselves. They're also unable to make decisions unless they have someone else's approval. And they are also usually very clingy and very submissive in relationships. So they're willing to tolerate absolutely anything, including abuse, because they're terrified of abandonment. The last personality disorder is obsessive compulsive, in which a person is rigid and stubborn. They feel that they have to be in control over everything. So you might find a workaholic in this category. And people in this category may also feel depressed due to their extreme working behavior. Do those make sense? I know it's kind of a lot. Okay. All right. I have a question for you. Okay. Would anyone like to volunteer their answer? Okay, that's fine too. Um, so the answer is C. Dissociative amnesia describes an individual who has experienced an episode of wandering around in the trance-like state and forgetting personal information, which describes Lauren, who traveled 80 miles in a trance-like state and has a new personality and no recollection of her previous life. A personality disorder doesn't fit Lauren because of the amnesia aspect, so A is wrong. Dissociative identity disorder also doesn't involve amnesia, and it describes alternating personalities, which Lauren doesn't do. She just forgets her original personality. Finally, delusional disorder is also wrong because it describes people who can't tell the difference between what is real and what is not. Does that make sense? If it makes it easier, you guys can just press like the yes button on the participants window. Okay, cool. Thank you. All right, here's another question. So would anyone like to explain their answer?
I can volunteer. I just eliminated A and B straight away because I feel like it's pretty contradicting to the information that's given. And I just remember borderline personality disorder like involved manipulation and like unstable in self, like how they reflect upon themselves. So I'd like to see.
Yeah, thank you. So that was great. This question is asking you to identify which personality disorder this person is in. So, an antisocial personality disorder describes someone who is aggressive and shows no remorse. They aren't necessarily impulsive, unstable in mood, or manipulative. So, A is out. Generalized anxiety disorder describes someone who is anxious about a variety of things and can be irritable, but that doesn't fit the question. And finally, dissociative identity disorder again describes someone who alternates identities with different people. So that would be wrong as well. C is our answer because people with borderline personality disorder are described as impulsive and have extreme mood swings and who is impulsive. So before we move on to neurocognitive disorders, does anyone have any questions about personality disorders? It's kind of funny. Okay, so let's start with Alzheimer's disease, which, if you're not familiar with, is a type of dementia that affects the elderly, most commonly in those who are in their 80s or 90s. So, those with Alzheimer's disease experience anterograde amnesia, which is the inability to form new memories, and they also experience retrograde amnesia, but stepwise, meaning that the oldest memories are spared. So, as the disease progresses, their newest memories will fade first. You also need to know the difference between anterograde and retrograde amnesia. Um, it took me a while to remember those when I was studying, but really important for you guys to know the difference. So, beta amyloid proteins and neurofibrillary tangles characterize Alzheimer's disease. These protein plaques and clumps impair the cortex and cause cell death and negatively affect neuronal connections. As we can see in this photo, there is less mass in the brain of someone with Alzheimer's disease. There's not much you need to know about the mechanisms or causes of this disease, other than it has a high degree of heredity, meaning that it's genetic, and it's caused by these beta amyloid protein and neurofibrillary tangles. The second neurocognitive disease we'll discuss is Parkinson's disease, which is a movement disorder and is caused by cell death in the basal ganglia and substantia nigra, which are two brain regions that produce dopamine. So the symptoms are tremors and rigid or slow movements. Language is unaffected, and so is memory. The treatment for Parkinson's is administration of L-DOPA, which is the precursor for dopamine. The reason why L-DOPA is given and dopamine isn't is because L-DOPA can pass the blood-brain barrier, but dopamine can't. Yes, you are correct. Retrograde memories are the first. So retrograde amnesia means that the oldest memories fade, but in the case of Alzheimer's, it's stepwise. So thinking about this in terms of the past, the newest previous memories. So, okay, let me rephrase this. So, childhood memories are spared, but memories leading up to the present fade away. Does that make sense? Okay, good. All right, here's a question. Yeah, so the answer is D. So only number three is correct. Parkinson's disease is not caused by the overstimulation of dopamine producing neurons, but rather a decrease in dopamine due to cell death in the basal ganglia and substantia nigra. So number two is the case of Alzheimer's disease, which, like we talked about, is caused by the accumulation of neurofibrillary tangles and plaques in the cortex. All right, before we move on to stress, does anyone have any questions? Okay. So the three types of stressors you have to know about, the first being um, a catastrophe, which is an unpredictable large-scale event, such as a hurricane, wartime events, or 9/11, for example. These events may lead to PTSD, anxiety, and or depression. The second type is a significant life change, such as moving, losing a job, marriage, divorce, or the death of a loved one. So it's less extreme, but still pretty stressful. And the third type, which is the most mild one, it's daily hassles. So everyday stresses caused by bills, traffic, losing things, scheduling work and activities. And while these stressors are things we deal with every day, they might be overwhelming to some people. So the effects of stress can be pretty damaging. When we are under stress, we release a hormone called cortisol. Cortisol causes the body to use fat as an energy source instead of glucose. The reason for this is because the brain can only use glucose as an energy source. So the body uses fat instead so that the brain can use glucose for energy. The problem with this is that high blood pressure and sugar is maintained. The long-term effect of stress the MCAT requires you to know is a weakened immune system. And stress may also cause heart disease and anxiety, depression, but the big one is a weakened immune system. And here's the question for you guys. Okay, so this question is asking you to identify which part of the brain is responsible for memory. So that would be the hippocampus. The function of the somatosensory cortex is to process sensory information. The basal ganglia produces dopamine and is responsible for motor control, and the nucleus accumbens is responsible for reward. The hippocampus is responsible for learning and memory, so it makes sense that a decreased volume of hippocampus would mean impaired memory. So again, it's really important, especially for the psych section, to understand the different brain regions and their functions. So before we move on to sleep, does anyone have any questions? Okay, so there are four stages of sleep that you have to know, and it's important to be familiar with the different waves. So these waves are measured by an electroencephalogram, also known as an EEG, which measures electrical impulses. When you are awake but relaxed and are drifting to sleep, so you're nice and relaxed, the EEG will read alpha waves, which has a low amplitude and a high frequency, as you can see in this graph. But when you're awake and vigilant, like right now, I hope, the EEG will read beta waves, which have a lower amplitude and a higher frequency, as you can see here. So it's really easy to tell the difference between alpha and beta waves. So remember, alpha is when you're relaxed, sleepy, and beta is when you're awake and vigilant. Stage 1 of sleep is non-REM, or rapid eye movement. Theta waves will predominate during this stage, which are low to moderate in intensity and have a medium frequency. During this stage, you will have fleeting thoughts. The second stage of sleep is also non-REM. Theta waves will be intermixed with K complexes and sleep spindles. K complexes last for half a second and they look like this in this diagram. So it's a large wave. And sleep spindles are little bursts of waves with high frequency, as you can see over here. And during this stage, your heart rate will slow down and so will your respiration. Your body temperature will also decrease. And going into deeper sleep, stage 3 and stage 4, which is also non-REM. And we are now entering slow wave sleep. So as we move into stage 4, delta waves will predominate, which is the deepest level of sleep. So you can see here towards the right side of the graph, the delta waves are starting to show. So delta waves have high amplitude and low frequency. So during this stage, heart rate and digestion will slow down further and growth hormones will be released. So now we're entering into REM sleep, which is the last stage of sleep. During this stage, you will have bursts of quick eye movements and your brain waves will resemble beta waves, which predominate when you're awake. So technically it appears that you're awake since the brain waves are kind of similar. REM waves are lower in intensity and they have a high frequency. Another difference is that there is no skeletal muscle movement and you are able to dream during REM sleep. So the reason you are paralyzed during REM sleep is thought to be so that you don't interact with your dreams, which is pretty interesting. All right, here's the question. Yeah, so when you're in stage 3, you're in deep sleep, so it's harder to wake you up when you're in this stage. Okay, so the answer to this question is B. So this is more of a recall question. Sleep spindles are observed in stage 2 of sleep as well as K complexes. So this type of question you might see on the MCAT. And some more facts about sleep. You require less sleep as you age, which is crazy because I think about my grandparents and they sleep like all day. So yeah, elderly people require less sleep. And infants, babies sleep like 16 hours a day, but elderly people will sleep like 6 hours a day. And one sleep cycle lasts around 90 minutes. All right, here's another question. Yep, this is another recall question. So muscle paralysis occurs during REM sleep, which is when we dream. Like I said before, I'm not entirely sure if this is true or not, but it's cool to think that it is. The reason why we are paralyzed is so that we don't interact with our dreams. So it will be REM. All right, we're almost to the end. The last thing we'll talk about is sleep disorders. The first type is dysomnias, which are abnormalities in the amount, quality, and timing of sleep. An example would be insomnia, which is difficulty falling or staying asleep. Another example is sleep apnea, which means intermittently stopping breathing during sleep. So while you're sleeping, you stop breathing for a few minutes and you usually wake up very tired. So it's very low quality sleep. And the third type is narcolepsy, which is a periodic overwhelming feeling of sleepiness during the day, which lasts for less than 5 minutes. It's characterized by sudden attacks of sleep. Okay. Finally, we have parasomnias, which are abnormalities in behavior during sleep. The first type is somnambulism, which means sleepwalking, and this occurs during slow wave sleep. Then we have night terrors, which is when a person sits up or walks around during stage 3 of sleep, and they usually appear very terrified. Important to distinguish this between nightmares, since nightmares occur during REM sleep and night terrors occur during stage 3. Okay, here's our last question for today. Okay, so the answer is A. Insomnia is caused by an overall reduction in the amount of sleep and is a common symptom of generalized anxiety disorder. It is categorized as a type of dysomnia, which is an abnormality in the quality, timing, or amount of sleep. In this case, it would be amount of sleep. And parasomnias are abnormalities in behavior during sleep. Okay, we finally reached the end. Thank you guys for coming to tonight's topic session. I hope you found it helpful. You can email us anytime with questions, and do not forget to join our Slack group in case you want to reach out to us there or to any of your peers. This Sunday, very important, we'll be holding a passage practice session. So I'll give you maybe 1 or 2 passages on psychology/sociology pertaining to what we talked about today. And if no one has any questions, I hope you have a great night.